Lagos State is Nigeria's worst hit city in the coronavirus pandemic. But despite this, the state government has been expressing confidence that the situation will not deteriorate to that of Europe. Health Commissioner Akin Abayomi, at a press conference in Lagos, revealed that the government has adopted measures to ensure the situation remains under control.
Lagos is well endowed with medical practitioners in the public sector. We have a large number of medical practitioners or healthcare professionals in the private sector. Yes, there is a shortage in Nigeria, but generally Lagos is doing much better than any other state because people tend to migrate to Lagos before they migrate out of the country. So we are not struggling at the moment with healthcare professionals, either nurses, doctors, or ancillary support. And yes, we're receiving volunteers. People who have gone into early retirement are coming back. People who are allied healthcare professionals are coming back. They're going through training. We're training every day, Monday to Friday, sometimes over the weekends. So we're training several tens to hundreds of practicing practitioners and those that are volunteers.
Abayomi also explains that Lagos has enough healthcare workers on ground to address the pandemic. He says even retired healthcare practitioners have offered to support the government in providing care for infected persons, and the government in return is providing them with necessary training.
Yes, we have 3 laboratories. They are molecular biology laboratories. That's the only laboratory where you can get 100% accuracy. I explained that already. We plan to increase the capacity of each of those labs to over thousands. But it takes time. It's a stepwise process. And we are ahead of the outbreak. So we have excess testing capacity. And with every day that passes, we are increasing our testing capacity. So far, I think the rate of positivity is still very low compared to what we've seen in China and in Europe. In China and Europe, cases were going up by the hundreds every day till they reached the thousands, and then they started going up by several hundreds per day. Our strategy is effective. The strategies that we're deploying in Lagos, we're only seeing between 6 and 10 positivity a day. That's a very, very slow rate of increase compared to what we've seen in Europe and around the world. In America and in England, you've seen how their numbers have gone into the thousands in 1 or 2 weeks. We're still under 100, and every day we're creeping up, and every day we're discharging. So it's plus, minus every day. And we're not seeing, because of the strategies we've deployed, we're not seeing that steep a rise.